a little bit about COVID-19 specifically and the impacts that it's had on our industry, specifically here in Snohomish County. So if you didn't know how to pronounce Snohomish County, that's how you pronounce Snohomish County. I'll start off initially with responder safety, things that we discovered as we moved along. So as a county, we were able to work together because we worked together on a few other disasters beforehand. So we've had a little bit of an ability to get together and coordinate activities. So we were coordinating activities on this event fairly early on. One of the things we tried to do was to acquire early and plan for the long term enough PPE, specifically the N95 masks, so that way we had a sufficient amount to operate. And the team that went together to do this actually determined how many calls we had in a 3-month period in the same 3 months previous year, so 2019 January through March. How many incidents did we have? How many responders responded on those incidents? And then assumed that there would be a need for an N95 mask on every one of those calls for every one of those responders. And that's how much we ordered in that regard. So at the time being, we still have enough N95s to operate, but because there was no further masks coming in, we're starting to do a PPE conservancy process. So we're conserving our PPE as best we can. We're responding a little bit differently, but I'll get into that in a little bit here. So try to acquire what you think you're going to need early on. Try to acquire a lot. Side note on that, it's actually provided us with the impetus to start to look at other parts of our supply chain, specifically EMS supplies. We generally buy have a month's supply of EMS supplies on stock, buy it about every weekly to stock up what we've used. We're actually reconsidering that and maybe going to a 6-month supply, buying once a month that which we need to restock, so that in the event we have something else that happens, we don't have an interruption to our supply chain that basically cripples us. So acquire PPE early on. PPE, what are you going to need? N95, surgical masks, if possible, hand-sewn masks if we can't get them, goggles, face shields, gowns, gloves. Our gowns are now lab coats. When we run out of gowns, we have about 7,000 lab coats that we've been purchased as a county. We bought considerably more than that. Our share for our department is about 7,000 lab coats. So we're going to use those because we can't get gowns now. You may get to a point where you can't buy a large quantity and you're going to have to start going out on your own, each individual agency, trying to buy what you can when you can. It's kind of where we're at the moment, but luckily we're on the downhill side, so our curve is flattened out. We're not utilizing as much as we were before. Comes continuing firefighter safety, single point of entry into fire stations. There's one way in, one way out. In that location, there is a way to sanitize, check your temperature, ascertain, do a self-check on yourself as to whether or not you're feeling right, no coughs, things of that nature, and basically sanitize your hands and decon your boots. Any shoe that comes into it, it's walking from the outside, it goes into the fire station, gets sprayed down with a sanitizer to keep those clean. So the idea is to keep it from entering the fire station. At the same time, you want to make sure that as your crews are passing past each other, doing pass on, you really have to limit the interactivity that takes place there. They need to have some separation. We've pretty much pushed them out to the truck bays. We said, you're going to do your pass on out in the truck bays, probably keep the doors open so that we keep air moving through that area. Don't loiter once the pass on is done. If you're not supposed to be at the station, leave the station and go home. We don't want them hanging out, having breakfast together. We don't want crews that aren't supposed to be there in the workout room working out together. That is all done for the time being, because if that infection gets into your facilities, It's not so much that it may actually infect everybody within that facility, but the simple fact that they were exposed to somebody who is infected, somebody that becomes sick, means that in all likelihood, you'll have to take everybody that was exposed and put them off shift and into quarantine for 14 days. And you can imagine how that could how much damage that could do if you have somebody on shift B and shift A was the shift that came in on them, and shift C is the one that's coming to take over, and somebody on shift B came down with the COVID-19 while on shift. You could potentially have to take everybody on 3 shifts and quarantine them. So you're trying to isolate that as much as possible. Where are we at? Cross-contamination. Like I say, not on duty, not in the station. Consider the fact that if somebody does come down with C19 within your facility, you're probably going to want that do a much deeper decontamination of that building. So it doesn't hurt to get on board with either finding a company that can do that for you, or locating the equipment that you can do it yourself. Now, spraying and wiping down works well. They do have these foggers, static foggers that can assist with that. They're getting difficult to find those machines. Those machines actually work well for doing your EMS units as well. If you have an aid car, an ambulance that does transports, and you transport someone that's highly suspect of COVID-19, does not hurt to have one of those devices at the hospital to be able to perform that complete decontamination of that rig before it heads back. So look for those items, try to get them if you can, and plan on likely having to do that. You may even consider taking a monthly or semi-monthly decontamination of the stations if you have the resources to do that. Once again, is it likely that it's going to spread as a result of being within that station? Probably not a great degree, but there is some potential there. But the other thing this thing buys you is a peace of mind for your crew. Your firefighters are going to feel much more comfortable about being in that facility if some form of decontamination takes place, especially after if there's been anybody in that facility that's come down with COVID-19. You don't want to start that in the firehouse of that, the perception that you don't care about their safety. It will pay dividends in the long run. On that note, make sure that whatever you're using is basically acceptable. And if with the IAFF or whoever else, make sure that it's not a carcinogen. We've had that issue. It's like, well, we're going to use product A, and they come back going, oh, that's been shown to be a carcinogen. We're not going to accept that. Well, we don't want to cause other problems. So make sure it's stuff that actually will pass scrutiny. For your firefighters, while they're in the station, we maintain that they do a self-check routinely through the day. So that means they check themselves when they come in, they check themselves in the middle of the day, they check themselves again before the evening. The idea is do a temperature check, preferably with infrared non-touch. Do an assessment of your own self to make sure you're not coming down with a cough or getting a sore throat or anything of that nature that makes you feel like perhaps something's happening. Try to catch it early and see what's going on. Now, the downside to all of that is with all of us, we start self-checking and we're like, you know, I got a tickle in my throat. Could that be it? And you start really getting, in the past, you would have just blown past that without any trouble at all. Be careful about creating your own symptoms. Emphasize that as well, just that you want people to check themselves. You want to make sure that they're safe, and you want to make sure that if they're starting to feel a particular way, that we isolate them out from the rest of the crew. Video conferencing like this works well for interaction between the stations. So right now, our battalion chiefs will move from station to station when they need to, but generally they are not entering the station. If they need to communicate with those individuals at station, we use a teleconferencing platform, or we use the telephone. The battalion chiefs used to come into the admin building. They don't come in the admin building anymore. We've got a shipping container out back that we had for storage. We've now put everything in there that if we need to move mail out to the crews or they need to bring something into admin, that all takes place out in that shipping container. The battalion chief never enters the administration building. We're trying to make sure that the administration building remains isolated, because once again, if you get a COVID-19 scare within your administration building, you essentially take the top off the organization. You could have isolating those facilities out in amongst themselves is going to be important. Oh, and the other thing I can't emphasize more, if COVID-19 starts to uptick in your community and you're starting to see a lot of activity take place and a lot of concern, all I can tell you is that routinely communicate with your crews. For the first 3 weeks, I think I sent out an email every day. It was about a page to 2 pages long, explaining what was happening, where we were at, if we had any incidents within the station, how many incidents we had in the county, what the county was doing, how we were working together, explaining all this to them so that they got a constant feedback. One of the things I had to implore to them was to understand that what I'm telling you today may directly and absolutely conflict what I'm going to tell you tomorrow. We may have a complete change of heart about how we're going to deal with something over the next couple of days. Because as more information comes in, we start changing how we're going to operate. And I'll get into it on the book here. We literally had at the beginning 3 levels of PPE to enter an incident scene. And we have since gotten rid of levels 1 and levels 2. We're just now at level 3. So it seems a little odd that the only PPE requirement in the playbook is level 3. We got rid of the other 2. Once again, conflicts. That happens as you move along. But explain that, get that out in front early on so that they understand that there are going to be conflicts and we're doing the best we can based on what we know on any given Sunday. So a liaison, we call them the COVID-19 czar. We assign somebody within our organization, and most of the agencies in Snohomish County have, for someone who can then basically deal with the deluge of information and get through it and be able to come out, extrapolate what the information we need, hence the creation of the playbook. The ability to track people that have been impacted. In other words, if you put somebody out on quarantine, you need somebody who can track that individual, who can determine when it is appropriate for them to come back to work. We've bounced between what we call the 772 rule, which was vetted with our EMS doctor locally and our public health department and Department of Health. And that was that if a person came down with a C-19 apparent infection, in other words, they had the flu, they had a cough, or they had a fever and they had a cough, we put them off work. And they could not come back to work until 7 days had passed from the onset of symptoms and 72 hours after being asymptomatic. So once the symptoms disappeared, they had to be off work for an additional 72 hours. I believe that has now moved from a 772 to a 1472. So from the day of onset, 14 days have to pass, and then 72 hours past symptoms, whichever is the longest. So if you have a COVID-19 czar, somebody who can perform those functions, they are also the primary voice to the firefighters. Yes, you're going to be putting out things from the chiefs or the EMS chief or ops chief, excuse me. But if you have somebody from the rank and file membership, a paramedic, if you have them, they can become your COVID-19 czar. Then they have a direct interaction with these individuals on a regular basis. They are people that they trust as being from the line. And the COVID-19 czar has an understanding of what's being expected of them from the fellow crew members. Just make sure that the messaging from your COVID-19 czar is consistent with the messaging that's being provided throughout the rest of the department. In other words, you want to have that consistent, constant messaging. Even if it's changing from day to day, it has to be the same from everybody that's giving it. And so the ability to funnel that through one position, your liaison, is very helpful. The ability to track what's going on with your firefighters and your crews is paramount. And it just helps tons to be able for you as chiefs and deputy chiefs and assistant chiefs to be able to perform the other functions of your job. It took us about 3 weeks to be able to get somebody on board, maybe 4. During those 4 weeks, I should say probably for about 5.5 weeks, I did not do any part of my normal daily job. I did strictly COVID-19 stuff. For 5 weeks, I took everything, threw it off my desk and said, I'm done with daily activities. Little concerned that somebody finds out that I can actually be out of the loop for 5 weeks doing my job and it doesn't affect the department. But it is what happened. If we could have got this individual on board sooner, I could have been back doing some of my stuff that I needed to do and not focusing strictly on COVID-19. Got all that. Implements playbook, monitors, tracks, exposed. Yep. Oh, and testing. Find out a way to get testing for first responders handled on a regional basis. If you can find a way to be able to get C-19 testing done together as a team with your Department of Health or Public Health or whoever it needs to be, so that way you can get them in the door, get them tested as a priority, and get that test back as a priority. Because once again, if you have somebody that's potentially exposed and may have it, you want to find out early on, so that way you can decide whether or not everybody else that's been in touch with them needs to be off as well. If they come back negative, you probably return everybody else to work. If they come back positive, then at least you know that they need to be off work. And we've had that issue where we've had people off for a couple, 3 shifts, only to find out nobody had C-19, and so they can all come back to work. So the faster you get it, the better off you are. And like I said, regional efforts work best here. Everybody trying to do their own doesn't have as much weight, as much strength. If everybody comes together and says, you know what, as a county, we need this to happen, and we're working together, and we need this to be able to take place, you have a much stronger voice. So your labor unit, do not hesitate to get your labor unit involved early. Rope them in on this conversation. Get their feedback on things. They have a ton of resources available to them through the IAFF, and if they're part of the solution, then they don't become part of the problem. All I can say is that if you can provide them with your concerns and your proposed mitigations and get their feedback on it, make sure that it's going to pass muster, see if there's any places they can shoot holes in it. You're going to be better off beforehand than actually trying to do something and then getting the blow back afterwards. We've had a really good working relationship with labor in Snohomish County, especially in these regards. They've bent over backwards to work with us in allaying the fears of the members, as well as providing feedback on the type of, once again, like the type of sanitizing material that we use in the station. So, the ability to get them on board means that if you can speak as a unified front with labor, it really cuts down on even future problems. The ability to speak together as one, come out with the same messaging, works wonders. We've had, up until last week, we had a daily regional meeting with all the fire chiefs in Snohomish County, deputy chiefs, the EMS doc, and a few other people, Red Cross, Department of Emergency Management. We would all meet in a teleconference every morning about 10 a.m. and discuss whatever it is that needed to be discussed, provided information from what has impacted our agencies, try to define what equipment needs were necessary and where we were at in the ordering process, and what ideas we could come up with to help with all of this. Labor had a representative in those meetings. They were always a participant. They always had an opportunity to speak. During those meetings, we've, like I say, we've gotten very, we're down now that we're past the curve a little bit. So we're having those meetings twice a week. But we literally, for a few weeks there, had them every day, including Saturday and Sunday. It was just an ability to stay connected. And one of the areas that we've found is that as we were moving through, we realized with these meetings that we were going to have to conserve our PPE if we were going to continue, because as once again, it's hard to get anything anymore. And so we became creative, hence the lab coats. We've also discovered that we can utilize UV technology, UVC, I believe. What we found is that there was a company that was making UV lights to clean the CPAP masks. And they can clean N95s. And so we can continue to use N95s beyond just one-time use. We can actually throw those in there for 5 minutes. Nice thing is we can also throw cell phones in there. We can throw stethoscopes in there. We can throw BP cuffs in there. We can clean a whole host of items with these little devices. So now we've extended at least our N95 mask consumption. We no longer have to be as concerned about our N95 mask. We can stretch that out a little bit. The other aspect of conservancy that we've done is that we've used what we call the scout system for our EMS calls. We essentially send one person to the door in full PPE. Everybody else stays back, not necessarily gowned up and ready to go, not with the masks on. One person does a doorway triage. And this is for the patients that you suspect might be that are not critical, not sick, if you will. They go to the door, and we try to get the patient to the door if they can get them to the door. And we do that interview right there and triage, and then decide how many people need to interact with them. If it's going to be a simple transport, it might be just the people doing the transport that will gown up, get them in the back of the ambulance, take them to the hospital. If it sounds like there's more work that needs to be done, then everybody will gown up and more work will be done accordingly. So, but the ability not to have 2, 3, 5, 7 people walk up to the door, all in N95s, all in gowns, all in goggles, face shields, whatever, has really cut down on our usage of that material. So the ability to look at alternatives is also going to be paramount. Do not expect, as you know, your normal supply chains to be able to facilitate what you need. You're going to have to get outside the box and get creative. We literally had considered the fact that if it got really bad, we might be using garbage bags. You know, cut a hole in the top and arm sleeves and use something with long sleeves on them. Down the lines of uniforms, we told them to quit using their what we call the standard Class B system. We went with what we call a Class C, which is basically a T-shirt. Because when they get to the hospital, if they were dealing with a COVID-19 potential patient and they did anything that did any type of invasive procedures, especially anything that might have atomized air within the back of the rig, we wanted them to essentially strip down out of their uniform and put it into a garbage bag, if you will, tie it up, store it on the unit, and get into a Tyvek suit when they after they've done their decon of the rig and come back to the station. When they come back to the station, they then wash their uniform in a washer machine right off the bat before they enter the station. We want them to maintain a good decon in any type of this event that has a high probability of passing this along. And we want the unit decontaminated before they come back home with it. What we found as we went along with this, as they were deconning their gears, that they would actually have to, in some of the stations, the washer machine was in the truck bay. In other stations, it was back by the dorm rooms. We didn't want them walking themselves and their uniform all the way through the station, past the dorm rooms, the living quarters, and using that washer machine. So we actually went out for the 2 or 3 stations that we needed to, bought some cheap washer machines, put them in the truck bay, and said, that's your decon washer machine for your uniforms. Haven't had to use them a lot, but once again, we're preventing the ability to get this into the station, and we're providing a peace of mind for those individuals that are working out in the middle of this, that are being exposed to this, and ensuring to them that we're not going to introduce it into where you live for 24 hours. We're going to take that out of that location as best as we can. So let's see, cooperative arrangements. I talked about using a regional approach, meeting regularly, sharing your stats, working with neighbors on program development. We established what we call a playbook within the county. And the idea behind that is that it's a county playbook because we all can take it, modify it to suit our needs, but it's essentially the same thing. The last thing that we wanted to do was to have one of our firefighters say, you know what, we're sending people back to work after 72 hours of being asymptomatic, but the fire department next door is keeping them out for 14 days. How come? How come we're not doing the same thing they are? So we're having all of this vetted through our EMS docs, our Department of Health, Public Health. Make sure that what we're doing is based on good science and that it takes into consideration the potential for stripping the workforce that is necessary to provide the services to the community to combat this disease. And so we essentially adopt the same process and procedures. Everybody has the same time frames. Everybody has the same process. Everybody has the same PPE requirements. Everybody has the same decontamination requirements. It's all the same. So that way it's all consistent. And if anybody's working together on it for mutual aid, the expectations are the same. There's no inconsistency between agencies or between firefighters. So best practice, yep, emergency management for logistics. You know, you need to document everything because at the end of the day, we might actually get reimbursed for some of this, or might get reimbursed for part of this. Once again, if you're buying as a group, it makes it a lot easier because you can put experts in place at the county DEM level that can ensure that it's properly documented, ordered through the proper procedures in the proper ways so that you do get reimbursed, or at least it qualifies for reimbursement. So the other thing we did as we were moving along and we were preparing for a high degree of impact is we established what we would call a fire operations center or a fire coordination center. Now, each agency would usually do one of these in the event that we had a dispatch outage or a potential for an impact due to a saturation of calls. Say a storm was running through and we were going to end up getting units dispatched all over the place, and we were going to have to triage those calls to make sure that we had the appropriate units going to the appropriate locations, not stripping our resources. We'd been talking about doing a centralized FOC, at least amongst the major agencies within the county. This particular event, COVID-19, actually forced our hand. And once again, because we've worked together with each other on a few other areas, it wasn't that difficult to do. But we had picked this fire station that was somewhat centrally located, that had a command system already set up, and the major players in the county that probably cover 85% of the incidents and population came together in that facility and established a fire communication center where everything operated through that entity. Now, that entity didn't really have to do a lot during this time period because we never hit those thresholds when it came time to actually triaging incidents and deciding how many units were going to respond and what kind. Our call rate actually has decreased up until recently to about 20% below what we normally do. Everybody pretty much hunkered down and has been in hiding. And I think to some degree, they don't want to go to the hospital because where do we take all the COVID-19 patients? To the hospital. So they don't want to go to the hospital because that's where COVID-19 is. They just assume stay away from there. But unfortunately, sick people need to go to the hospital, and the longer they delay that, the greater their chances of becoming very sick. So we know we've got that coming here pretty soon. But the ability to create the FOC, Fire Operations Center, allowed us to come together, also allowed us to put together a system of alternative response units, ARUs. And our alternative response units were essentially designed to be like a Tahoe or a vehicle staff car that had some basic first aid equipment and 2 EMTs on board. And these individuals, if necessary, would be dispatched to what we call the Protocol 36 calls, which were the low acuity calls where they potentially could have the COVID-19 symptoms, but were not necessarily exhibiting other signs of being sick. They might have had that, but they weren't like heart, they weren't stroke, anything of that nature. And so if we started seeing a lot of calls, if our hospitals were starting to become saturated to the point where they didn't have room, we would then have utilized these alternative response units to be able to send them to people within, if they could get there within 15, 20 minutes, that would be great. And they get there, they do the triage, they determine whether or not this patient actually warranted a transport to the hospital or would be better for them to stay home. Now, they would do this in conjunction with discussions with the EMS authority on duty at the time, be it an emergency room doctor or the county EMS doc, which would have been in the FOC. And then they would be able to ascertain whether or not this individual needed transport. If they do, they call for a transport unit. If not, they give them instructions and tell them to stay home. We'd have about 4 or 5 of those running through the county, and we would just dispatch them through the fire operations center to those calls as they came up. We might have a number of them stacked up in queue, but that's okay because they're not the ones that we're as concerned about. So, but it then would free up the opportunity to ensure that our transport units were going to places that needed to be transported, or paramedics were going to people that actually needed ALS services, and keep our engine companies somewhat, or suppression companies, available for the activities that they need to do. If we start running suppression units everywhere on BLS calls that aren't going to need to be transported, we end up without a suppression activity capability. We don't have the ability to deal with rescue events, and it doesn't do our community any good to completely strip ourselves down. The FOC also put into play, as does each individual department did, but an ability to work together if we needed to fill out an engine. In other words, if an agency had been hit with a number of COVID-19 quarantines and didn't have enough resources to staff one of their units, we would tap labor on the shoulder in Snohomish County and say, we need resources for this engine. What can you do for us? And they would go out and try to find some resources on the labor group and staff that engine. That was the plan. We never got to that point, but that was the plan. And then we also had a plan for what stations would we need to actually brown out in the county so as not to impact overall everybody, but be able to be absorbed by the other stations in the county by moving crews around, so that if a station, a district, a fire department actually got impacted hard and perhaps took 2 or 3 stations out, we could actually move resources into some of those stations, maybe only take one of those stations out, maybe take another station out on the other end of the county and take it down. So that way there's not an impact in just one regional area that's very heavy, that we spread that out a little bit. So we put those plans into play so that in the event we needed to do that, we hit that tripwire, we could just move into that aspect, and it was already planned out ahead of us. So with our FOC, we also roped in, once again, our dispatch center, our EMS doctor, and DEM. So it's nice to have dispatch in there because they could then coordinate those activities with us. They knew it was coming, and we could explain to them what we needed, what we were expecting to do, and they can accommodate that. Our dispatch center actually had 2 locations that were available to them because originally they were 2 different dispatch centers. They've combined into one about 3 or 4 years ago. So they still had 2 facilities. One was being used, one was a backup. They've actually split their dispatch system into those 2 facilities to try to help isolate their personnel from each other. So the event if COVID-19 gets into one of the centers, the other center is still up and operational and is not impacted by that. They can try to isolate that out. They were actually looking for a 3rd location to use temporarily if it got in, if they needed to, and purchasing equipment to do that. So the nice thing about having the dispatch center in our FOC is we told them we needed 6 radios in there to be able to communicate with the crews in the event that we needed to do that. And they came in and brought us 6 radios and set them up with antennas and power supplies, and it was good to go. So we have all that equipment in there ready to go, and we didn't have to worry about trying to scrounge around and find them out of our own stations. They took care of that for us. So other things that we tried to implore to our people directly is that as first responders, you are an example to the community. This comes with some costs, but the idea is that they should be examples of the community. They don't mingle with crews. They don't sit outside in the stations. They don't come down to admin. Our shop is isolated. People bring a vehicle to the shop and they park it out front. They leave the doors open, let it air out, and then the mechanics will come out and grab the vehicle, bring it in, and do what they need to do, wipe it down, sanitize it, park it back out front, leave it with the doors open so it can air out. The crew will come back over, do another cleaning, and take it home. If the shop is going to go into the station, personnel need to go into the station to work on facilities equipment. The crew is instructed to clear and vacate the area that they'll be working on. The shop crew still has to do everything as far as sanitizing and cleaning and checking temperatures before entering the building. They'll do a wipe down if they need to of the area they were working at, and then vacate the building before the crew goes back into that area. But once again, they have to be the example for the community. At this point in time, we're making it optional that if they wish to wear surgical masks in the station, that's up to them, but we actually recommend and encourage they do that while out in the community. We've limited the amount of time that they should be going into the community. In other words, we're not doing inspections, we're not doing public relations events, and we're limiting the amount of time that they actually go to the store or whatever to pick up material for lunch, or dinner. They prefer that they do that before they come to work. But if they do go out and about wearing surgical masks, not only helps the community and helps themselves, but it also provides a good example that they're able to do the same thing that we're asking the community to do. Talked about all of that stuff. Don't mingle during off times. Public messaging. We have public messaging that's done through the DEM, Fire Operations Center, and all the agencies combined. Once again, single message from everybody. We don't have conflicting messages going out to the public. Frequently, a single message will be put together for like social media and will simply be shared by all the agencies. So it's the same exact message from every agency that's going out, be it a video or a meme or whatever it takes. It's the same messaging that goes out between all the fire agencies and other agencies. It's all regional based. And then, yeah, and share it within your own department and other departments. So it's a good opportunity to use media not normally utilized. We actually used for some public information stuff. Our public information officer was to use Facebook Live. They actually could not go into the stations, but they had people within the stations walk through the station and show them an open house. So we had a Facebook Live open house. Did a Facebook Live of our COVID-19 czar, explaining what the activities were, what was happening, and what their job was, and what to expect, so that the community understands why the firefighters or EMTs are showing up at their door with gowns and masks and goggles or face shields. It's not because they necessarily believe that those individuals are COVID-19 positive. They're just doing it for everybody. So I'm going to throw up here real quick a screen share if I can, right here. There. Can everybody see this okay? I don't hear anybody, so I'm assuming so. So if you can see what's on the page right now, I got a response checklist for COVID-19. You'll notice that all EMS calls, high precaution, level 3. Level 1 and 2 are gone. Level 1 and 2 actually caught our department off guard because we went to a patient that was complaining of, what was it? Basically a diabetic problem. And they had been to the hospital the day before, did not get their prescriptions filled for the diabetic problem, came home, was feeling poorly, did not exhibit any signs or symptoms of flu-like conditions. Crews transported them with level 1, took them to the hospital, everything was fine. About a week and a half later, get notice, oh, by the way, that patient was C19 positive. Okay, so they've been exposed, so now we have to put them on quarantine for the balance of the 14 days. Now, the nice thing in working with our doctor is that there was concern that if these individuals that come back to the station, they'd been exposed to a C-19 patient potentially. Do we have to put everybody else off that they came into contact with? And our EMS doc, working with Department of Health, basically came to the conclusion that they considered that to be a casual contact, that if the firefighters were not symptomatic, that they're just in the firehouse together, that would not be considered an exposure. And they just needed to simply self-monitor, but they did not need to put everybody off. But the people that were actually exposed to that patient had to go off for the balance of the 14 days. So that has helped us in our ability to limit the impacts to our human resources, to be able to limit that impact. But you want to make sure you get buy-off on that from people that actually have the ability to say that's okay. So, well, once again, our playbook, I'll just run through this real quick. Aerosol generating, transporting instructions, all of this stuff gets laminated and put out into the crews. This thing, and I'll go through the beginning, you notice has a work period of 4/9 to 4/16, current work period. By 4/16, it'll change again. It might not change a lot, but something will change. But this way we know exactly which one it is. So, and South County Fire is the one that put this together. When we get it, we put our emblem on it and submit it out accordingly. So there's our level 3 high level PPE. Once again, level 1 and 2 pictures are now gone. They used to just have red X's over them. Oxygen advanced airway management with different N95 type of bag valve masks. Highlighted areas, hospital notification checklists, decontamination checklist, decontamination non-transport unit, response workflow, how to go through this process to make sure that everybody's safe. You notice at the bottom, hospital, the driver goes in, registers the patients, and coordinates with the staff. Great jump off point to the fact that you want to be able to get your hospitals roped into this through the Department of Health and your EMS doctor, so that if all your hospitals are playing off the same sheet of music, then it's easier for the crews going in and out of there. If one hospital is doing procedure A and the other hospital is doing procedure B, it becomes difficult and concerning. So we get the hospitals to understand what's going to happen and how we're going to access them and what their expectations are, because they had concerns about people walking through certain areas that were potentially COVID-19 patients that maybe they didn't want them walking through with that patient. So everything's getting coordinated all the way up and down the line, from the time we pick up the patient to the time we drop them off, which reminds me one more aspect of that. Not only do you coordinate with the hospitals at the end point, you coordinate at the beginning point. If you have adult family homes, nursing homes, get them part of the talk and discussion as to what the expectations are. Once again, if that patient can be taken to the front room or the front foyer or the front door, that's where you want to interact with them at an adult family home or a nursing home. Get that word out to those entities so that they can get those people out there if they can. If they can't, they can't. But if they can, that keeps us from walking all the way through that facility, potentially exposing not only us, but also exposing all the rest of their patients to us. I mean, we're going out and visiting C-19 potential patients. So we want to make sure that we limit our potential to expose them. Decon workflow, level 3, BC sick leave algorithm, once again, how to deal with a potential COVID-19 patient. Make it consistent, make it so that all your BCs understand that, or whoever it is that's going to be dealing with people that are potentially calling in for sick. There's a sick employee workflow, we've modified it for our purposes, but essentially it's the same. South County Fire has a monitoring, actually exposure forms for their people. And then protective measures in the fire station. Once again, at the bottom, employee self-assessment monitoring, restricting access, employee daily sheet, fire station strategies for crew safety, wearing masks, kitchen and meal time, wiping down everything, and best practice for PPE conservancy. Once again, conservation. That's where we've gotten to this point, is how to deal with this issue. So we try to lay everything out so that way it's the same for everybody, and we've got everything handled or covered, if you will, we still discover more things. Hence the reason why it's only going to go to 416. We'll probably have something new that comes up in the next few days that we need to address. So I'm going to stop sharing right now. And we're back. So that is pretty much the list of everything that I could think of that we've dealt with. The biggest thing to take out of that is maintain consistency, maintain regional aspects, and tackle this as a team. Don't try to go it alone. So, yeah, decon your boots, absolutely. We have, like I say, everybody that comes in the station decons their boots. They do a decon when they come back from calls. Yeah, there's spray bottles. You can use a boot bath, but we found that some of our individuals were coming to work with tennis shoes on. They're a little concerned about getting up over the top of the soles. So we've gone with a spray. I believe it's Virex. They spray the bottom of their boots or their shoes, whatever the case may be, and they do that routinely. So I don't believe our lab coats are necessarily washable. I believe they are disposable lab coats, though there has been some discussion about at what point in time do they become washable, because we need to keep them. At this point, I think we're in good shape. We probably have enough lab coats to last us a while. So how this all started and what they should look out for in the event a surge begins. Yes, that's things to look out for. So all of this started essentially because we had the first COVID-19 confirmed patient in the United States showed up probably about 15 miles away from us here. It's at our regional hospital. Actually heard from the EMS doc that the individual came in and said they weren't feeling well, and they had this cough, and they came from China. And they said, doc said, okay, they checked them out, couldn't find anything, sent them home, did the tests. Test came back positive, and they're like, ah, crap, this guy's at home. We got to get him back to the hospital. How are we going to do that? So they took what they had in place for potential Ebola patients and set up an ambulance for that and brought this patient back to the hospital. Confirmed first C19. After that, next county down in Kirkland, they had a number of firefighters that got exposed and basically quarantined them in their fire station. Like, I can't remember, 12, 13 of them. Everything I've heard said that was probably the most miserable event any of them have ever been through, is being quarantined in a room in a fire station for 2 weeks without access to anybody else or anything. Probably as close to prison as you can imagine. So that's how it started here. Is we started to see that uptick, and the state started to come into play and started to shut things down to try to get a handle on this. We started seeing potential COVID-19 patients because we were tracking that information. We're starting to keep track within our EMS system, our EMS documentation, to look for those things, and we're able to get stats out. Our dispatch system actually started asking specific questions dealing with potential COVID-19, and then would broadcast that out in the dispatch of a potential need for additional PPE, so that our firefighters were not wandering into these without pre-hand knowledge of what they were stepping into. So dispatch got involved with it, EMS system got involved with our EMS council and EMS doc. Ability to maintain stats across the county was important because we could start to see the influx. So that's what we started to see with the surge. We started to see those upticks. Luckily, that uptick did not reach the threshold that exceeded our hospital's capacity and did not exceed.
Oh, hi, Fire Chief's webinar, Marysville.
Hello. So anyhow, so what to look out for? You got to be able to track that data on a regional basis and have somebody watching for it. If you start to see the signs and symptoms within the information that you're getting back in reports or information that you're getting from the dispatchers through the triage system, that's a good indicator of things are starting to uptick. We're actually seeing our call load start to go back up, but not for C-19 related events, more like our basic run-of-the-mill everyday events that we go to. So not doing too bad there in that regards. But and yes, the playbook can be shared. I just I'll shoot it off to Chief, and you can more than happy to utilize that to modify it to suit your purposes. Right now it's in a PDF format. I can send it in a Word document, but what we got it from was from our neighboring agency, and I think they created it in another format. And so the first 2 pages are technically like a 9.5 by 13. Good luck with that. But if your printer is capable of scaling, it'll be fine. We just scale it down to 8.5 by 11 letter size and it works. But it did create some problems for us initially. Just forewarned. So.
That's a good segue. Just make sure everybody logs into the members only section of the Ohio Fire Chief's website. And there are tons of resources, including an earlier version of the Chief's document here. We'll update that once he sends that off to us as well. But there are tons of resources that are available. The office and a couple of chiefs have been working their tails off keeping things updated there. So make sure you go check that out as well.
Yep. So that's where we're at. Anybody's got any more questions, I'll try to answer them as best I can. But otherwise, all I can say is coordinate and consistent, same message. Everybody the same, and just imagine what could happen and then prepare for it. This is going to change the way we operate from here on out. We're looking at UV lights for our ambulances. We're looking at UV lights for our HVAC systems in the stations. In the past, we would have done a minor wipe down of the aid car when we got done at the station. We're probably going to be doing routine, deeper cleanings on these things. The stations will probably be cleaned with these fog machines on a routine basis. It's elevated to a new level. This will be a demarcation from the past in how we operate in EMS in regards to potentially pandemic viruses. So.
Chief, again, thank you so much for taking the time to give this presentation to everybody. I really appreciate it, and stay safe out there.
You too, guys. Be careful.
Thanks, everybody. Be safe.
Thank you.